This is a video on how to perform a nasopharyngeal swab. This video is a collaboration between the BC Centre for Disease Control and the Ministry of Health of British Columbia. The purpose of this video is for aiding in the diagnosis of COVID-19. This video focuses on the proper technique for performing a nasopharyngeal swab. Nasopharyngeal swabs are commonly used to detect a variety of bacterial and viral respiratory infections. The swab samples the surface of the respiratory mucosa of the nasopharynx, the area where the back of the nose meets the throat. Although there are no contraindications to performing a nasopharyngeal swab, these can be technically difficult to perform. Therefore, it's important to have a basic understanding of nasal anatomy in order to ensure accurate test results. A central nasal septum, which is formed of bone, divides the right and the left nasal cavities. The nasal septum is quite sensitive to touch. It is important to avoid this area when performing a swab. The length of the swab correlates approximately with the appropriate depth for performing a proper nasopharyngeal test. This length is approximately 7 centimeters. It is important to note that at the proper depth of swab placement, the red mark on the swab aligns approximately with the tip of the nose. Be sure not to touch past the point on the swab where the red mark lies, as this could risk contamination of the sample. To begin, have the patient blow their nose to clear the nasal passages. Then ask the patient which side of the nose they breathe most easily through. This can be tested by having the patient occlude one nostril at a time while breathing in, and thereby comparing both sides. It is a common misunderstanding to envision the nose as a tunnel upward, when really it is best understood as a tunnel from front to back, from the nasal opening at the face to the end of the tunnel where the nasal passage meets the throat, an area called the nasopharynx. The hard palate separates the oral cavity from the nasal cavity. The swab should travel parallel to the hard palate, against the floor of the nose. Lateral walls or sides of the nose have multiple turbinates. These are bony outpouchings covered in nasal mucosa. Often, when the swab meets resistance here, it is mistaken for the nasopharynx. The swab should impact the nasopharynx, where the nasal cavity meets the throat, as circled in the diagram. Therefore, the direction of the swab can be understood as traveling parallel to the hard palate, along the floor of the nose, towards the direction of the ear. A proper swab travels all the way to the nasopharynx. Thus, inform the patient that this procedure may be uncomfortable. It may cause a burning or tickling sensation lasting approximately 30 seconds after the procedure. The nasal cavity may be most accessible with the patient's head tilted slightly upward. However, the best position is to be determined by the person performing the swab. As illustrated by the red line, the patient's palate position will change with their head position. Therefore, the ideal position is whichever position provides easiest access to the nasal cavity for the person performing the swab. Regardless of the selected position, it is important that the patient's head is against a headrest to avoid movement during the procedure. This is an endoscopic view of the left nasal cavity with the septum in the middle, the turbinate on the outer side, and the floor of the nose visualized at the bottom. The nasal cavity should be entered at a slight angle. This is because the exterior nasal valve or opening and the internal nasal valve or opening can sometimes cause resistance. This is the correct angle of entry. You may instruct the patient to breathe through their mouth during this procedure. If the patient feels they need to sneeze, tell them that they should raise their hand. To re-illustrate, the swab enters the nose at the same angle as the dorsum or bridge of the nose. It is then slowly rotated so that it is horizontal in position, parallel to the hard palate. Here we see the swab initially angled slightly upward. The swab should then continue horizontally, parallel to the hard palate and along the floor of the nose. The swab is seen traveling along the floor of the nose with care to not intercept the midline septum and traveling underneath the level of the turbinate. Towards the end, we see the nasopharynx, where the sample is taken. The swab remains here for approximately 10 seconds and is turned in one direction and then another. The swab is then removed gently but quickly along the same pathway. This is an example of a swab that is angled too steeply entering the nasal cavity. At this upward angle, the swab will not reach the nasopharynx as it is too vertical. Here we see the swab impacting the nasal septum. This is both uncomfortable for the patient and in the incorrect orientation. In summary, this video outlines how to properly perform a nasopharyngeal swab. It is important to have a basic understanding of anatomy and directionality when performing this test in order to minimize inaccurate diagnostic results. Take care to wear the proper PPE and handle the swab as per institutional guidelines.